This lab is a really exciting environment for the students because they get to participate in all sorts of active learning and experiential learning. They will have access to the donor pro-sections, they'll have access to our digital anatomy, they'll also have access to ultrasound and simulation while they're down here in the anatomy lab. And really what that brings is just a bigger understanding of the body. They're not just using one tool, they're using many. So they really come out of our labs very knowledgeable and very prepared for their next steps as they move into clerkship when they're going to be in the hospital treating patients.
This lab is great. We have access to the anatomy expertise of the people, the professors and the graduate students who work here, and access to all the facilities we need to really maximize the learner's experience and get them the clinical experience they need to do these procedures. I help to teach the emergency medicine residents at the University of Manitoba. It's a procedural anatomy-based session for them, and it provides them the opportunity to practice procedures that are either rare or invasive or intimidating for them in some way that we don't often encounter in real life. So it better prepares them to do these things for the first time once they graduate from the program.
It's a very newly renovated laboratory space. It's spacey, it's inviting, it's welcoming, and it has modern equipment on the auditory side, on the audiovisual side, equipment in terms of surgical cameras, equipment in terms of being able to project and having different software established here. So it tailors to the needs of the different learners that we provide education to in this laboratory.
They get to come in and work with our body donors from dissection to prosection to exploration of the body. So being able to take the 3D body that they see in front of them and all that anatomy that they've learned and then translate it up onto the screen so that they can practice using the tools of their trade right here in the anatomy lab, I think is fantastic. So I could not do without any of my imaging technology.
Medical students, dentistry students, physio students, all kinds of health profession learners are able to utilize this lab for their anatomical teaching. In my role as a surgical resident, we've had the opportunity to practice procedures and surgical skills here. And then even in my role as a graduate student, I've seen graduate trainees be able to do their gross anatomy labs here. One of the biggest opportunities it allows for us is the ability to actually get hands-on experience doing surgical procedures on cadavers in kind of a low-stress, low-risk environment before we kind of have to do those procedures for real.
There's nothing more realistic than doing a procedure on an actual human cadaver. These are the silent teachers. They give us the gift of a complete and real human anatomy. You can't replicate that with a simulation facility or a computer screen. You can't simulate the feeling of doing a procedure on an actual human body, and that's a huge gift that the donors provide for us.
This body donation program is extremely important for all types of learners in the 5 different colleges at all levels of their training, whether this is undergraduate, graduate, postgraduate, and even clinical learners.
We also get to rehearse the stress and the fear that comes with doing a procedure on an actual human being. And this is the only place we can do that without endangering patients as we're learning.
Our silent teachers are the best teachers for our students, and the students learn so much from them, and the best way that someone can do that is to come in, learn about the program, and donate if that's something that they want to do.